Hello, so I will be focusing on the psychologist Alfred Adler. I will be discussing his life story, his development of the psychological theory, critiques, and major contributions to the field. So Alfred Adler was born and raised in Vienna on February 7th, 1870. In his early childhood, he suffered from a lot of handicaps. He developed rickets, he had spasms in his vocal cords, and he was diagnosed with pneumonia around age 5 after his brother died. He was raised in a large family, and he often felt inferior of his older brother. This concept is important to the development of his theory. Later on, he graduated with a medical degree, and he focused on ophthalmology, but then switched to general practice a couple years later. Where he lived, his patients were mostly working in the circus, and if you know anything about the circus, it was there was a lot of social inequalities, which inspired his theory of inferiority and compensation. Later on, he met and worked with Sigmund Freud in the early 1900s after defending one of his theories. They became acquaintances. I wouldn't say that they became friends, but Adler became the first president of the Vienna Psychoanalytic Society in 1910, but then left after a year later. There's been some disagreements if Freud kicked him out or not, or if he left. It's still kind of unknown. The research points to both. After he left, he created the Society of Individual Psychology and worked as a psychiatrist. He fought for social equality for minorities, advocated for women's rights, and for equal opportunity and pay. His political views are very important to the development of his theory also. So he coined the term individual psychology, which attempts to explain human behavior through a teleological position, which basically emphasizes that behavior is goal-directed. Every individual strives for their unique goal, and that is reflected through all aspects of their personalities, so the way they act, how they feel, what thoughts they have, and emotions they express, they all reflect a goal that they are striving for. So individuals are innately born with feelings of inferiority. They feel helpless from the inability to be independent from the world and from their parents. This develops into the goal of superiority. They have one goal of existence, and they try to overcome their innate feelings of inferiority. The goal of superiority develops from either a child overcoming his inadequacies through compensation, or using their inadequacies to gain superiority over others. This is called compensation. So complexes arise when the sense of inadequacy is overwhelming. So we have inferiority and superiority complexes. These are both abnormal behaviors. Inferiority complex is an exaggerated sense of inferiority to others. They tend to exclude stronger individuals and use weaker people to feel powerful, whereas superiority complex is the overwhelming desire to be superior. So Adler described these as personalities. Also, one thing to note is that when people have a superiority complex, they have also often had an inferiority complex. They both kind of bounce off of each other. So his styles of life he coined as movements towards a goal. The three main problems of life are social, occupational, and sexual, or communal life, work, and love. They both mean the same thing. They influence the way individuals approach the problems of life. The lifestyle influences the approach to problems of life. Gibbon-Steinfeld is a German word for social interest, social feeling, or community feeling. All these words get mixed up and they just mean the same thing now, but back then they all meant something different. Which Steinfeld is the true value and knowledge of human nature, so no use of harm on others. People with these complexes do not have a sense of social interest. So the experience of pampering, organic inferiority, which is born with physical disabilities, and neglect in early childhood makes it difficult for individuals to develop social feelings. So they often have a staggered growth of social feelings, or they never develop a sense of the communal feeling. So his theory changed when he was a physician in World War I. After World War I, Austria enhanced school and educational reform, which then emphasized his encouragement and patient strengths in his theory. After 1922, he opened up many childhood guidance clinics that specialize in educating teachers how to work with children who have special needs and children who struggle with special needs. So there again, he facilitated that encouragement through the strengths of children with special needs. Some critiques of the theory: some say it's not empirically based due to broad theories and treatment. There are some arguments that it's okay that Adlerian therapy and theory is not empirically based, while others say no, it actually is important that Adlerian therapy develops more and more studies to where it can be considered evidence-based practice. Assessment, which is one of the approaches of therapy, is often time-consuming, and you have to have a lot of insight in your thought and your development. Initial limit of 3 life tasks, additions to spirituality and self as life tasks. So these were added. No guidance on how to work with children in elementary schools, which is why they developed Adlerian play therapy to use in schools and private practices to understand more of early childhood development. Adler's developmental theory, early childhood experiences, birth order, early recollections, is not holistic to explain all styles of life and overall behavior. So Adler often emphasized a holistic approach, but some critiques say that this is not actually holistic at all. It's actually a very, very narrow scope of human behavior. The degree of discouragement and social interest is not enough to address mental health. So Adler didn't actually want to pathologize people. He mainly focused on these two things to encourage people. So he never really worked, if I'm correct, with pathologizing his patients. So today's popularity of the theory. So there are actually some evidence-based practices that are branched off from Adlerian thought. So we have Adlerian play therapy and Adlerian pattern-focused therapy. These don't encompass all of Adlerian therapy. They just branch off into one strict scope of the therapy. Adlerian family therapy focuses on family constellations, lifestyles, and goal-directed behavior. This has not been empirically proven. Also, Adlerian therapy is increasing in popularity among multicultural populations because of its emphasis on gender, culture, ethnicity, racism, sexual orientation, and now the new approaches encompass spirituality and religion, as well as social equality. So here's a study that looked at the popularity of Adlerian therapy. This was in 2002. You can see that Adlerian therapy is not even on the, it wasn't even on the list. Whereas in 2013, this was the most recent study that came out before 2022. Adlerian therapy was very much at the bottom. So these are just some studies that I thought was interesting. Here I have 5, 6, 7, 8 studies all within the past 5 years that focus on Adlerian therapy. Research is continuing to focus on Adlerian therapy. It is not a lost practice of psychotherapy. It is very much still being researched today, as you can see with the vast variety of different types of topics that researchers are looking at. So we have some incorporations of cognitive behavioral, evidence-based, relational, cultural, Adlerian framework, play therapy, assessing one's lifestyle through tattoo narratives. This one I thought was very interesting, and intervention-based programs with teachers who are struggling with feelings of burnout. So the Adler University, this isn't technically emphasized, but I just wanted to note that people are still very interested in learning about Adlerian therapy. As you can see, they had many students enrolled in the last year. It was an 8.2% increase, and they have an overall of over 1,000 total students. So there are still people interested in Adlerian therapy, and like I said, it is not a lost practice of psychotherapy. All right, and these are my references. Thank you so much.